What if I told you that depending on your body shape, you're at increased risk for certain medical conditions? Take, for example, the apple shape, which is people who have fat around their abdomen and their thorax or their chest. These patients are at increased risk of heart attacks, strokes, diabetes, metabolic syndrome X. You get the picture. The reason is they have fat around their major organs, which puts a strain on them and increases those risk factors. Now, we also have people who are triangle shaped, which basically means they have fat all the way up here. For these patients, they usually have pains on the back. They have increased breast size that could cause a lot of strain on the back as well, especially in women. And this may lead to problems with the spine. And we have the pear shape, which is basically people who carry fat from the waist down. Now, pear-shaped patients are at increased risk of having joint pains or osteoarthritis. So hip, knee, ankles, those joints can be a problem. They're also at increased risk of varicose veins because of all the weight they carry from their waist down. Some studies are telling us that in these patients as well, they have some distribution of fat in their abdomen that increases their risk of heart disease, diabetes, strokes, and so on, but they don't have as high a risk as the apple shape. Then we have the ruler. The ruler is pretty much straight. The fat is evenly distributed, and they usually look good no matter how big they get. The reason is that it's just streamlined. The problem with this body shape is that when they get obese, it's very hard to spot because they look good. The thing that they're at increased risk for is bone diseases. We're talking osteoporosis, osteopenia, so brittle bones. So that's something you want to look at if you're ruler shaped. And then finally, we have the hourglass shape, which everybody loves. The hourglass shape are at increased risk of having back problems if they have really nice bosoms. They're at increased risk of having hip, knee, and ankle pains depending on how much fat they distribute around. Regardless of the shape you are, you want to love the body you're in by dieting, exercising, and doing all the good stuff for your health. That way, you're keeping yourself in tip-top health. Thank you for watching, and I'll see you next time.